Good afternoon, everyone. Welcome to this afternoon's webinar, or I guess this late evening's webinar on the role of the role of a drug access navigator and access to medications during the COVID-19 pandemic. Before we get started, I'm just going to go over a few things with you. So thank you to our sponsors. Without our sponsors, holding these webinars would be practically impossible. So thanks to Amgen, Binding Site, BMS, Janssen, and Takeda for their support through unrestricted educational grants. So we're doing a lot more webinars these days because of the pandemic, and so a lot of the stuff that we would normally bring to you at a live meeting, such as our national conference, is being provided online. And actually, I forgot to tell you, I'm Gabriele Colasurdo. I'm the Manager of Education and Patient Services at Myeloma Canada. So in case you're wondering who is speaking, it's me, Gabriel Colasurdo. As I was mentioning, we are doing a lot of webinars these days, and our next webinar is going to be on Monday, May 25th. We're lucky to have Dr. Arlie McCurdy from the Ottawa Hospital to be presenting on relapsed refractory myeloma and what to expect. So, from everything from how to detect a relapse or how to monitor before relapse, and what to expect once a relapse does occur. And so that's on Monday at 3:30 p.m. Please note there was a time change. This webinar was supposed to be at 1 o'clock. However, we had to move it to 3:30 p.m. Eastern Standard Time. So all of our webinars are recorded. You can see our recordings on YouTube.com. If you go to YouTube.com and or from the YouTube app, if you write Myeloma Canada in the search bar, one of the first results you'll get is our channel. We have a subscribe button. Subscribing will allow you to get notifications every time we add a new video online. So that's a good way to stay up to date with the latest videos that we have. From our website, myeloma.ca, you can also access our recordings if you on the bar on the top. If you click on resources on the menu here, this big menu will open up and you have some selections here, and you click on educational videos. That'll just redirect you to the YouTube channel, so it kind of cuts out the step of having to search for us and all that stuff. Lastly, before we get to our presentation, how do we ask questions? So feel free to send in your questions during the presentation. I will receive them. I will ask our presenter those questions at the end, and we'll have a discussion that way. So to ask questions on your GoToWebinar software panel or on the application that you have, you click on the questions function or the questions tab over here. Then you have a little box where you can type in your questions. Clicking send, I'll get the questions like I mentioned, and I'll be happy to ask them. So without further ado, I'd like to welcome our presenter today, Amy Pilon, who is Executive Director of ODANO, that is the Oncology Drug Access Navigators of Ontario. She is also a drug access navigator in Owen Sound, as well as a steering committee member for Drug Access Canada. Amy, thanks so much for taking the time to join us here today.
Great, thank you for having me. So I'll just get started here. So that's a lovely little picture of myself. And as Gabrielle said, my name is Amy Pilon, and I started this role about 5 years ago. I'm a business graduate from Humber College in Toronto, and I began this career 5 years ago when it started as a new position in my hospital. I began my journey with ODANO as the Director of Education, and now I'm sitting as the Executive Director. I'm also sitting on a new steering committee for Drug Access Canada, which will be hopefully launched in the next couple weeks or months, depending on COVID. I've been working with the Atlantic provinces on implementing their own drug access group as well. Some of the initiatives I've implemented with ODANO are a preceptorship mentorship program. It's currently on hold because of COVID, and I'm really excited to share my insights from a drug access point of view with you all today. This is Alan Birch. He's the founder of Drug Access Canada. He was the previous executive director of ODANO. And some of the content of today's presentation was in collaboration with Alan, who is a navigator out of Toronto. Some of the things that we're going to go over today is what is ODANO if you're not familiar with who we are, as well as what a drug access navigator is, again, if you're not familiar. Quick overview of Ontario's drug reimbursement systems and how drug navigators can assist patients and physicians during COVID-19, and then any questions anybody would like to ask at the end. So ODANO is a provincial organization of healthcare professionals that help cancer patients access their medications. And this can be through either oral therapies or IV therapies, just depending. So what is ODANO? ODANO holds teleconferences with various partners to keep us up to date on launches of new drugs, patient assistance programs, and their offerings for patients and any changes that happen to access. As we all use our email network that connects all navigators to advise on changes to Cancer Care Ontario or the Exceptional Access Program, it's otherwise known as the EAP criteria for drugs, as well as any changes. Our educational teleconferences are generally led by pharma teams and are for drug access navigators to keep us up to date. ODANO members also have the opportunity to attend various educational events. For example, we've had representation at CAPO, which is Canadian Association of Pharmacy and Oncology. We were attended there in Nova Scotia last year. Unfortunately, this year's was canceled in-person event in Toronto. Some of our members were to speak on a panel on drug access in Las Vegas this past April at a new conference called the Health Advocacy Summit, but that has well been postponed, but we will be there when it is rebooked. And we hope to share with our American partners the differences and successes we have in access to the newest therapies for patients without financial hardships. We offer our membership a yearly conference held every year in Toronto in October, and it allows your drug access navigator to expand their networks and education even further at an event that's strictly focused on oncology drug access navigators. This is the group of us from Ontario that attended last year's conference. Good looking bunch, I think. So what is a drug access navigator? This role began to help patients and physicians with the complexities in drug reimbursement in oncology clinics. Patients have enough to deal with new or existing diagnoses without having to worry about how to access their drug. The first drug access navigators in Ontario started as a pilot project from a pharmaceutical industry. For example, Amgen sponsored my role in my center for 2 years. After that time, the value of the role was recognized by my oncology center and became a permanent position. This was much the same scenario at various other centers within our province. You may also hear the terms medical reimbursement specialist, drug access facilitators. The background of many of our DANs vary from pharmacy technicians, pharmacists, social work, business backgrounds. So there's really no special education for this. It's more learn on the job. This can be done through
Hello?
Hi, sorry, I just lost my connection here. So access can be done through public insurance, private insurance, or from pharmaceutical patient support programs. And some patients need a mix of all three of those programs. While most cancer drugs are funded through our public system, however, newer therapies or regimens are only accessible through patient support programs, private insurance, or paying out of pocket. Some drugs are accessed through a program called SAP, or the Special Access Program. This is for drugs that do not have Health Canada approval, but whom pharmaceutical industry has made available to patients. Drug navigators will often meet with sales reps to learn about new drugs on the market, new programs for patients, and changes in access. The reps meet with pharmacists and doctors to go over data on the drug, nurses for side effect management, and DANs for accessibility. Everyone in your healthcare team has their own focus. That's just a little pictogram there of how we all work together as a team. Physicians will approach the pharmacy team, the DAN or the pharmacist, to discuss treatment options. We then meet with patients after the physician has prescribed their drug and determine if they can access the drug through EAP or through their private insurance. We determine if they will need the Trillium drug program and assist with expediting an application if necessary. If there is an appropriate patient support program for the patient, we will enroll patients there as well, depending on the patient's need for copay assistance, home delivery of medication, or a variety of other services they offer. We can complete EAP applications, that's the Exceptional Access Program, special authorization forms from insurers. After we have completed a thorough investigation to determine the coverage needs, we organize delivery for free drugs from manufacturers and coordinate with private infusion clinics for privately paid IV therapies. Some navigators, when meeting with sales reps, will access patient information kits and guides as well. Some larger cancer centers will have several drug access navigators. For example, Princess Margaret has several reimbursement specialists as well as the Jabrinsky Cancer Center. For some larger centers, DANs will take a focus. For example, they may only handle oral therapies or drugs associated with supportive care or hematology, so their focus is much more specific. Just going to give a quick overview of Ontario's drug reimbursement systems because it is a fairly complex system to navigate through. So IV cancer drugs in Ontario are funded by Cancer Care Ontario, while in British Columbia, the funding is through the BC Cancer Agency. IV therapies for patients who meet their strict criteria are funded by CCO at no cost to the patients. Patients only have to meet criteria for drug funding. For example, daratumumab is used in combination with bortezomib and dexamethasone for the treatment of patients with multiple myeloma and good performance status who've received at least one prior therapy. In Ontario, orals and certain classes of injectable drugs are funded by the Ontario Drug Benefit, or you'll hear it referred to as ODB. Qualifications for access to ODB ranges as well. For instance, if a patient were to be prescribed Revlimid, a DAN would be involved as it is an oral therapy. For those over 65 years of age and under 25 without private drug plans who are automatically covered by ODB, everyone between 25 and 65 can get ODB coverage through the Trillium drug program, which if a patient has access to a drug navigator, can usually expedite the process for them. But this group of patients, however, need to pay a deductible, which is 4% of the household income. The drug benefit covers approximately 4,400 different drugs. Some are general benefit, where others require submission via EAP, the Exceptional Access Program. An EAP is a requisition form that the DAN completes with the physician and submits to the Ministry of Health and Long-Term Care. Patients, again, must meet specific provincial criteria for those. You will find drug access navigators across Ontario, across Canada. They're in British Columbia, Alberta, Quebec, and the Atlantic provinces. Each province has their own provincial formulary and funding mechanism. In addition, private insurance tends to be similar across Canada with similar forms and processes for patients. So while our roles are all different, there are many areas where we all do the same work. As of April 2019, drug access navigators in the Atlantic provinces are banding together to form a group similar to ODANO, the Atlantic Canada Oncology Drug Access Navigators, or ACODAN. They're combining New Brunswick, Nova Scotia, Prince Edward Island, Newfoundland, and Labrador. Quebec is also in the process of creating a group that's unique to that province as well, and hopefully in the future you will see a group formed in British Columbia. Drug Access Canada, I briefly mentioned, is a new program. I've been fortunate enough to be included on a steering committee for this newly formed group that is being founded by my colleague, Alan Birch. The goal is to combine forces across Canada to streamline the work of navigators and share best practices and education nationally. Our roles are expanding into other fields such as cystic fibrosis and multiple sclerosis. This association would eventually be for all drug access specialty areas. Drug access in oncology is complex and becoming more complicated. Patients cannot navigate the systems themselves. Physicians cannot keep up with the numerous changes and programs in oncology drug access, and drug access navigators take on this and work collaboratively with physicians in advising on new drugs and programs available to patients. Genomic testing is also becoming increasingly commonplace in oncology as there are more targeted therapies on the market. This is fast becoming a space for drug navigators as well, as we're requiring to access these genomic testing to qualify for access to those specific medications. So how can navigators assist patients and physicians during COVID-19? There's many ways that we can do that. We can enroll patients in something called a PSP, or a patient support program, that offer home lab draws, supportive field nurses, home deliveries of drugs. For example, if you're on Xgeva for supportive therapy and you've lost your private insurance coverage, you may be eligible for free good during this time and home delivery of your drug, along with support for self-teaching, or in some cases, nursing to give an injection when home care cannot. Depending on the therapy programs and services change, your DAN will assess your needs, and if an appropriate program is available, they will enroll you. If you are being given a medication in the clinic, you may be switched to an oral therapy. Therapies that may require diagnostic tests for extension of approvals may be extended so that patients do not need to come to hospitals as often. I do know many have questioned why only 1 month's supply of medications are being dispensed during the pandemic, and this is to maintain adequate supply for all patients. This could be affected as to what country your medication is manufactured in and their situation during the pandemic. By providing a 1 month supply of drugs, it ensures all patients will be able to access medications, hopefully minimizing any drug shortages. I know personally, my blood pressure medication is limited as well to 1 month supply at a time. Navigators and pharmacists are provided updates from Cancer Care Ontario that are shared with physicians to help patients avoid having to come to the hospital. And I'm sure most of you are aware, many physicians are using telemedicine and virtual care. This is private and secure community for practicing virtual care, using a variety of ways to communicate and care for patients and keep them safe at home. Telemedicine is a practice of caring for patients remotely when the provider and patient are not physically present with each other. This may be done through a video conference or by telephone. Navigators are able to provide the same level of assistance over the phone and obtain either a verbal consent to enroll into programs, and can sometimes send documents via your email and still apply for drug access to your private payers. In Ontario, if you've lost your private coverage, navigators have the expertise to utilize all the programs designed for patients that a patient may not even know about. If you're having trouble accessing your drugs or your situation has changed, ask your oncologist to refer you to the DAN at your center, or you can contact ODANO at www.odano.ca with any questions, and we will try and put you in touch with the navigator associated with your oncologist. Navigators can even assist with things like sharps containers for blood thinners. If you're using home care support services or private infusion centers and you've been changed therapies due to closures, there might be a program offered that you didn't need before that you do now. You just have to ask your DAN. Some of the patient support programs that may be familiar to you are the Victory program. So that's sponsored by Amgen. They have the drugs Xgeva and Kyprolis. There's the RevAid program, and there's the BioAdvance program for Darzalex. The one program called the Victory Program is made available to patients via Amgen Canada and offers a variety of options for patients, such as appealing denials from private payers for coverage requests, private infusion support, and Innomar clinic injection services, nurse counseling, assessments for transportation and lodging services, and copay assistance for patients with less than 100% coverage during this time. They are also offering a case-by-case basis compassionate coverage if you've lost your private health benefits due to COVID-19. For example, if you are on carfilzomib, you may be eligible to have your regimen changed to a once weekly instead of a twice to limit your times needing to come to the clinic. For the RevAid program, all prescriptions are delivered to patients' homes. If you currently pick up your prescription at a RevAid certified pharmacy, you can ask for home delivery during the COVID pandemic. All support materials are mailed from RevAid to the patients upon initiation of therapy. Some centers would provide this directly to the patients in clinics, but you're still able to access those. Celgene is also offering a myeloma patient support program across Canada. This is a program to offer additional support over and above what is already given. If you have previously been enrolled in the RevAid program and opted out of this service, just let your DAN know and they can enroll you to opt in during the pandemic period. Within this program, there will be a dedicated individual available to speak with the patients in these areas to complement the support and counseling already received. This person is referred to as a myeloma guide and has a background in oncology and patient counseling. They are also able to help with disease education and will advise the patients and caregivers of community resources available, such as Myeloma Canada and multiple myeloma groups locally that they can join. The BioAdvance program offers support from coordinators and will, on a case-by-case basis, support patients who access DARZALEX via their private insurance who may have lost their private insurance during layoffs during this time. For those that aren't aware of Trillium, I was just going to give a quick little overview of what Trillium is. Who is eligible for the Trillium drug program? You must live in Ontario with a valid health card. It helps Ontarians pay for high prescription drug costs who do not already qualify for the Ontario Drug Benefit Program. For example, you are not enrolled in ODSP and who do not have an insurance plan that pays for 100% of your drugs or has a low annual maximum. The Trillium drug program covers the cost of more than 4,400 prescription drugs. These are oral and some injectable drugs that you would have a prescription filled at a pharmacy versus what you receive in the hospital that is funded by CCO or Cancer Care Ontario. Some drugs on this formulary require patients to meet certain criteria. A program is called EAP, or the Exceptional Access Program, provides the reimbursement criteria, and the Drug Access Navigator will do the required application and submit to the Ministry of Health and Long-Term Care for approval. What you pay is the deductible is usually about 4% of your household income after taxes. It's the amount you pay out of pocket. Once your deductible amount has been met, you will only pay up to $2 for each drug that is filled or refilled until the end of the program year. The program year runs in quarters. The first quarter is being August, September, October, second, November, December, January, third, and fourth, so on. What if I don't meet my quarterly deductible? If you do not buy enough prescription drugs to meet your deductible before the quarter is over, they will carry over your unpaid deductible to the next quarter. Submitting applications during COVID-19, your Drug Navigator can help with that. During COVID especially, but in general, your Drug Navigator can help you with your enrollment form and submissions. You will have to sign a consent allowing your Drug Access Navigator to participate in your Trillium application process, and this will be made available from your DAN. On the Trillium application, all signatures are to be original and mailed into the program. Trillium during COVID is accepting documents electronically, and the originals can be submitted after the outbreak is over. Trillium just had recently a news release, and I just highlighted it here for you. On May the 13th, the province issued this news release to making prescription drugs more affordable during COVID-19. So effective May the 13th, people using the ODB program will not be required to pay any co-payment until July the 1st. And the new Trillium drug program households can apply for income reassessment to help reduce the financial burden for families. Your drug navigator can assist with this as well. If a Trillium drug program household has experienced an income change in 2019 or 2020 of 10% or more compared to their 2018 income, they can apply to have their deductible recalculated by completing and submitting the annual deductible reassessment form, which is available online on the Ontario website. A quick fact to ensure that there is adequate supply of medications in the province during COVID-19, pharmacists and physicians are dispensing 30 days or less of medication at a time. And I'm open for questions if anybody has any.
Thanks, Amy, for that overview. I'll remind everyone to ask questions. Just type them in. I'll receive them, and I will ask Amy the questions. And so here, the first question is: do all cancer centers have a drug access navigator?
In Ontario, they do. The amount of drug navigators available in other provinces vary. Alberta, I know, has 2. I think Quebec has 20. Ontario specifically, yes, there's a drug navigator in each cancer center.
Okay, great, thank you. And so, what if you're being treated at a cancer center where, for example, there is no drug access navigator? Are you still able? Can you still somehow benefit from a drug access navigator, and how would you do so if you can?
In Ontario specifically, you can reach out to ODANO.ca, and they can connect you and assist with a patient support program. Patient support programs are available, though, across Canada for anybody who needs them. And certainly anybody in Canada can reach out to ODANO.ca. We do have colleagues in most provinces, and we can connect you with them.
Okay, thank you, Amy. Here we have a question about travel to access treatment or therapy. Is that something that drug access navigators can help with?
They can enroll you in a patient support program if that's one of the benefits offered by that particular program. So it would depend on which therapy you are trying to access. For instance, Kyprolis, that drug, they have a program associated with that medication that offers assistance with travel and lodging, whereas other therapies may not.
Okay, great. Thanks, Amy. Someone here is asking actually if we can just go back to the references, or they said the resources slide, but I believe they're talking about the references slide. So we'll just leave this up here for a few seconds. That way, so people can see it. I have one more question here. I don't have any other ones after this one, so please, if you have your questions, please do send them in, and we'd be happy to answer them. You had mentioned some patient support programs on one of your slides. Is there not a patient support program for Ixazomib, or Ninlaro is the trade name for that drug?
Yes, there is a patient support program for that drug, and your navigator or your oncologist would enroll you into that one. It's one that's not publicly funded in Ontario yet. It may have public funding in other provinces, but Ontario, it does not. Okay,
great. Thank you. So with that, I'm not getting any new questions here. So I guess with that we can end the webinar. Thanks, Amy. That was a lot of information. So for those of you who want to go back over the presentation, I remind you again This information it's recorded. It'll be on our YouTube channel, so you can go and you can access this later. If you have any questions after the fact, please do send them in by email at on contact@myeloma.ca for Myeloma Canada. We'd be happy to try to answer those. And lastly, before we go, I just wanted to remind you one more time, our next webinar will be on Monday, May 25th at 3:30. It'll be Dr. Arlie McCurdy. We'll be talking about relapsed refractory myeloma and what to expect. Amy, thanks again for taking the time to be with us this afternoon. Very much appreciated, and I wish you a very nice evening.
Thank you.
Thanks. Have a great one. Bye-bye.
Yep, bye-bye.